Welcome to the webinar, How to Complete the Health Form. Our purpose with this presentation is to guide us through the steps to successfully complete the health form so that we're eligible to go and attend clinicals. I encourage you to follow along with your gray health form that you received in class. If you do not have it at this time, please pause the video and retrieve it so that you can follow along as we go. And as we open our gray health form, the first box that we notice is the one for us to select our program of study. You'll see up here where it says check only one. If for some reason there are some older forms out there, and this is okay if there are, if it says just EMT and it doesn't have PTA or advanced EMT there, if your program's not listed, just simply write it into this box where it says program of study, and that'll be acceptable for submission. And then we get down to personal information there. If you don't have your Calhoun ID number, this should be located on your student ID that you received on admission to the college when you went to Student Services, or you can locate that on your schedule or the banner ID that you used to log in to complete your schedule. Please make sure to give an accurate emergency contact that you want contacted in case something should happen. We hope that never happens, of course, but occasionally we do need to make contact with someone. Please make sure that it's not an ex-wife who is currently hunting you down for money or someone who's looking for you. Make sure that this is an emergency contact that you want us to call for you. And that brings us down to the physical exam part. And if you look down here in the first box, it says to the student. Of course, obviously, we're going to fill that in. And where it says currently pregnant, yes or no, students who are pregnant, we need you to provide a statement from your OB/GYN that clears you to go to clinicals to make sure that you're safe, and we definitely don't want you getting hurt while on clinicals. If you have questions about that, you need to see our program clinical coordinator, and we can help you along a little further to that. Our next box down, it says to the physician, the height, weight, the vital signs that you see here, the pulse, the respirations, and your vision test, that can all be completed by the clinic nurse that's working that day. However, anything below physical examination notes needs to be completed by your healthcare provider. There are only 3 healthcare providers who are designated or qualified to be able to perform this exam to clear you to go to clinicals. They are a licensed physician, whether they're an MD or a DO, a licensed certified nurse practitioner, or a licensed physician assistant. Either one of those is capable of performing this physical examination. Next, if we flip to the next side, it should be over on page 3 of your health form. You'll notice up at the top where it talks about the essential functions box. And if you're looking at the screen here, you'll see the check boxes that say yes or no. And I've included the orange insert for our EMS program. If you're a member or a student of another program, just refer to the insert that you have or your essential functions form that was provided during your clinical orientation. In order to complete this component of the health assessment form, all of the boxes provided must be answered yes in order for you to attend the clinicals. Any box indicating no is going to require you to follow up for additional exams prior to the start of clinicals. And any additional testing or specialists required are, of course, at your expense. Probably the most common one that I see as a clinical coordinator that's always marked no is, does the student have, at a minimum, vision in one eye corrected to 20/20? Well, if you wear contacts or glasses, then your vision is corrected. However, a lot of physicians, nurse practitioners, or PAs will go ahead and mark that as no because you need that device or those contact or glasses, for example, to bring your vision to 20/20. Please remind them that all of those boxes have to be marked yes. If it's marked no, your clinical coordinator or your program advisor will submit that form back to you until it's corrected by a healthcare provider. The essential functions insert detail the necessary traits to safely practice in whichever program that you're currently in. The healthcare provider must be provided this insert during the health exam for reference if they need it. Students who do not meet the essential functions of their program are ineligible to attend clinicals, and consequently the student will receive a grade of F if you do not officially withdraw from the clinical component. Please make sure to carry that component with you. And of course, that is a form that you can sign and fill out. And that brings me to the immunizations and laboratories section. They're continued on page 3, right below the checkbox. In addition to the health physical, necessary immunizations and screening tests are necessary for that health form to be complete. And we're going to go through each and one of these, and I'm going to give you a brief description of each one of what they are so that we can kind of complete this health form. And the first one that we come to is a complete blood count, or what's known as a CBC. This is a type of test that requires venipuncture and is able to tell the healthcare provider information regarding the number of blood cells, platelets, etc. A differential is a very detailed analysis of the blood and is not required for admission to the clinical area. However, your healthcare provider is going to use their medical expertise to decide whether a differential is necessary or not during your health exam. The paper results of this test should not be included with your health form when being submitted. The healthcare provider only needs to sign that they have completed this test. Number 2 brings us to the urinalysis, or UA. This is just a basic urine sample, and this provides a variety of information to your healthcare provider. A microscopic urinalysis is not required for admission to the clinical area. However, again, your healthcare provider, using their medical expertise, is going to decide whether this is necessary based off of your physical exam. The paper results of this test also should not be included with your health assessment form. It is something to note that this urinalysis is completely different from the urine drug screen that you provide. Please do not have your healthcare provider at the clinic do a urine drug screen. That's not necessary. You only need to have a urinalysis. Your urine drug screen will be completed by whichever vendor your program is currently using at this time. Number 3 brings us to the tetanus shot, or tetanus D vaccine. This is an intramuscular injection, or a shot that's given into the muscle. It's usually the upper arm, and this initiates the formations of antibodies to the potentially deadly bacteria Clostridium tetani, or tetanus is basically what we call it. Students who have received this vaccination within the last 10 years are not required to repeat the injection, but should have the date of the vaccine administered documented in the appropriate box on your health assessment form. However, your healthcare provider may elect to provide a booster if necessary. The Department of Public Health actually recommends that if you've never received this vaccine or that you need a booster, go ahead and get that Tdap vaccine. That one helps you against tetanus, diphtheria, and pertussis. Again, however, though, your healthcare provider, that's kind of their decision along with you to be able to make. Regardless, the date of the administration needs to be placed in the box on the health assessment form. The only exception to this is a documented hypersensitivity or allergy to the vaccine. In the case of an allergy, just have your healthcare provider document this on the health assessment form. And that brings us down to number 4 on the varicella vaccine, chickenpox. It says a varicella titer or a disease date. We all know that chickenpox is caused by the varicella zoster virus. Most adults were exposed as children to this. However, students who have never had the chickenpox or received the vaccine will be required to receive it prior to entering the clinical area. The only exception to this is a documented allergy to the vaccine. Most younger individuals have received the vaccine for this going through their childhood. You just need to have your healthcare provider document that. If you have had it, sometimes the healthcare provider may elect to draw a specialized exam called a titer to determine whether or not antibodies have been formed in response to whenever you received the vaccine or when you were exposed before as a child. And that may be necessary for those receiving the titer who receive the vaccine again if the antibodies are insufficient to provide the necessary immunity to protect you from infection. Your healthcare provider will discuss this during the physical exam if it's deemed necessary. Otherwise, just have your healthcare provider list the date of the titer, the immunization date, or the disease date. The paper results of this test should not be included in the health assessment form. They should just document in the box. Number 5 brings us to the MMR, or the measles, mumps, and rubella, or rubella titer. The MMR vaccine is actually a 3-in-1 vaccine. It protects us against the measles, mumps, and rubella, all of which, of course, are potentially serious diseases. Most of us have received these vaccines or boosters during childhood, and therefore we should just have the vaccine dates documented. Your healthcare provider may elect to go ahead again and perform that blood titer if necessary to see if you have the antibodies. In some cases, you may have to repeat the vaccine in order to have the antibodies present. That, again, is up to your healthcare provider, and they'll document it in the box as necessary. The paper results of this test should not be included in the health assessment form. And that brings us down to the next one, the two-step TB skin test. And the CXR just stands for chest x-ray if positive. All students that enter the program at Calhoun Community College's Allied Health Department must submit documented results of a two-step tuberculosis or TB skin test. This test must be done after January the 1st of the current year in which you're in the program. And the documented test results must be submitted to the appropriate clinical faculty. And that's, again, we'll document these on those forms. Well, a lot of folks, we always get, well, what is the TB skin test? The TB skin test, or the MAN2 skin test, uses a syringe, and a Tyne test uses a 4-pronged puncture device. The Tyne test is not accepted. The only one that is accepted is the MAN2 test. So we need to make sure that the TB skin test that you're receiving actually uses a syringe, and the little 4-pronged device that we're talking about kind of looks like a Coke bottle top. It's usually round, and again, that's not accepted. These take the longest for students to complete because you can only receive one test per week. So if I had the test done on a Monday, I would have to go back on a Wednesday and have the test results read, which it ties up 1 week. And then the next week you come back and the healthcare provider will repeat the exam on the opposite forearm. Dates of each TB skin test must be documented and submitted. And most of the time your healthcare provider is going to elect to keep the gray health form in your health file at the clinic, just so that as you keep coming back to complete those TB skin tests, they can just go ahead and document it on the form. Should your skin test be positive, or you've had a positive test at any time in the past, you must have the results of a chest x-ray done after January the 1st of the current year of which you're enrolled. The results and form must be completed by your physician and submitted on the proper forms. Chest x-ray results in a health form must be submitted each year if your program is longer than 1 calendar year. Any student who can present documentation results of 3 negative tests over the past 3 years, for example, you can show me that you've had a TB skin test in 2011, 2012, and you received the third one on or after January 1st of the current year that you're in the program, will not be required to have the two-step test. The last negative test must be after January the 1st for this option. Paper results of these tests are acceptable with the health form because we will need to verify that you've had 3 priors done. With the chest x-ray, please do not bring the actual chest x-ray with you. You just need to bring the radiologist report where the doctor has actually read the x-ray. It's the type report that says that you're free of tuberculosis. The next one we're brought to is number 7, the hepatitis B vaccination series. You can start the series, show proof of immunity, or you can sign the vaccination waiver. All students entering into any allied health program are required to do one of those 3 options. However, your healthcare provider can help in a detailed discussion on whether or not you should receive the vaccination, side effects, and the risks of not participating. However, to assist you in a more informed decision, if you'll flip the page in your gray health form over to page number 6, it's the very last page in your health form that has type on it. And we give you the information there about the hepatitis B. A lot of folks that I deal with in educating students are always coming to me because they're afraid of HIV and they're afraid of contracting this virus versus that. Out of all of them that you are most likely to come across or most likely to contract, I'm more worried about hepatitis B than I am anything else. Only because that bacteria can live outside the body for up to 2 weeks, and that's a significant period of time that you could be exposed to this. I encourage you to please read that if you've never had the hepatitis B vaccine before, and talk with your healthcare provider whether or not this test is for you. Okay. And this, of course, is just the box where you should have those TB skin tests wrote by the clinic nurse. Also, the hepatitis B vaccine, if you're starting to receive those. The MMRs and tetanus you'll see on there, and then the disease date. If you had your chickenpox and you were 5 years old, write in the disease date on there, or have your healthcare provider write that on there for you. Next box, very important, it says to the physician. Again, this can be any healthcare provider such as a nurse practitioner, physician assistant, or your doctor. they need to sign that they've actually performed the examination. I know they've been documenting the form as you've been going through. We really need the signature on this form. They may use a stamp or they may just go ahead and sign it. If the form isn't signed, your clinical faculty or advisor will return the form back, and that just means another trip back to the doctor's office for you. Please make sure to have that signed. More importantly, if the physician or healthcare provider that you're seeing is unable to release you due to any type of mental health related issue, a separate mental health evaluation is going to be necessary in order for you to be considered eligible for the clinical progression. And if we look on page number 4 in your gray health form, we get them to the vaccination waiver. And you'll see where I've put in bold print down here that even if you're currently receiving the hepatitis B vaccine, you need to sign the waiver if you will not complete the vaccination series by the end of the program in which you're enrolled. This vaccination it takes some time to get this one done. You get the first one done usually while you're there at the office, or sometimes they have to order the vaccination series to be able to administer it to you. The second one is done at 3 months, and the third one is done at 6 months. Most of us who are in the program, if you're just now starting these series, you will need to sign the vaccination waiver, even though you're receiving the vaccine at this time. And that brings us down to the next step where it says proof of health insurance and health insurance waiver. As we're going through, students that are enrolled in the clinical courses are required to show proof of personal health insurance prior to the start of the clinical rotations. And a photocopy of this proof must be required to be submitted with the student health form by the specified paperwork deadline that was given to you by your clinical faculty. If you choose not to sign the proof of health insurance, you may sign the waiver, and students signing the waiver need only to sign the waiver. You don't have to provide any other type of proof or documentation. Any questions on how to complete the health form should be forwarded to your clinical coordinator. If you're part of another program, you may need to contact your specific clinical faculty. If you're in the EMS program, then you can contact me, Kenneth Kirkland. You see my telephone number and email address listed there. Or you can contact the Associate Clinical Coordinator, Mr. Tyler Mosley, and there's his phone number and email as well. I hope you found this webinar very helpful, and again, if you have any questions, feel free to contact us. Thank you.